Syphilis is an infection caused by bacteria called Treponema pallidum. Syphilis is passed most often through sexual contact. Syphilis can also be passed to a fetus or newborn during pregnancy or childbirth. Syphilis may also be passed through sharing equipment like needles and syringes when injecting drugs. There are often no obvious symptoms of syphilis. When there are symptoms, the first is often a painless sore called a chancre, usually on or in the genitals, rectum, or mouth. Other symptoms can include a rash on the torso, palms, or soles of the feet, headaches, and problems with vision or hearing. Without treatment, syphilis stays in the body even if there are no symptoms. Syphilis can spread to places like the brain, nervous system, eyes, ears, skin, bones, liver, kidneys, or heart. This can lead to some serious health problems. The good news is that there are treatments that can cure syphilis and ways to reduce your chances of getting it. How you deal with syphilis is your choice. Knowing your options can help you make the choices that are right for you. Condoms can help prevent getting or passing syphilis during sex. A newer prevention method uses an antibiotic called doxycycline to prevent getting syphilis. If taken after a possible exposure, this is called doxypep. If taken on an ongoing basis, this is called doxyprep. If you inject drugs, using new equipment every time will prevent you from getting syphilis. The only way to know if you have syphilis is to get tested. This usually involves a blood test and sometimes a swab of a syphilis sore. Get tested if you have symptoms or think you've been exposed to syphilis. If you're sexually active, regular testing helps detect a new syphilis infection early so you can get treated before it gets worse and avoid passing it on. If you or a partner is pregnant or thinking about getting pregnant, get tested before and throughout the pregnancy. You might need to remind your healthcare provider to make sure this happens. When you test for syphilis, get tested for other sexually transmitted and blood-borne infections too. If you test positive for syphilis, get treated as soon as possible. If it's caught early, syphilis can usually be cured with antibiotics, given by injection at one clinic visit or taken orally as pills for 2 weeks. If you've had syphilis for more than a year, the treatment is longer. After your treatment, keep in mind that you can get syphilis again, so stay proactive about prevention to reduce your chances of getting a future infection. Make syphilis testing part of your self-care routine so you can identify a new infection early. If you do get syphilis, get treated right away. These steps will help you stay healthy and, as a bonus, help keep others healthy too.